We'd like to thank JACS for the opportunity to publish our work. We know that thrombin is a central component to hemostatic capacity and important to consider in trauma-induced coagulopathy. The historical dogma has been that the majority of trauma patients present with elevated thrombin generation, which is paradoxical considering many trauma patients present with a hypocoagulopathic profile. However, on deeper dive, you see that the majority of research looking at thrombin generation in trauma patients has been in plasma. And whole blood thrombin generation data is lacking, which is important because we know there's cellular contributions to thrombin generation. We hypothesize that whole blood thrombin generation is lower in patients with overt hypocoagulopathy, and whole blood thrombin generation is a sensitive predictor of massive transfusion. We collected whole blood from trauma activation patients and then used this to measure whole blood thrombin generation in a novel prototypic point-of-care thrombinoscope. This works by the addition of blood, tissue factor, phospholipids, and calcium, and a fluorogenic substrate. The system works by continuously monitoring changes in fluorescence intensity over time as thrombin cleaves the fluorogenic substrate. It yields the following curve, which gives you lag time, peak thrombin, and maximum rate of thrombin generation. Amongst our 99 trauma patients, we found, in comparison to healthy volunteers depicted here in blue, indeed, after trauma, much like in plasma data, thrombin generation is increased. However, when you account for shock, which is present in many severely injured trauma patients, thrombin generation is significantly depressed. And this matters because thrombin generation effectively predicts early massive transfusion, as well as FFP transfusion in the first 6 hours. In conclusion, all trauma patients do not present with elevated thrombin generation, and deranged thrombin contributes to the hypocoagulopathic phenotype of trauma-induced coagulopathy. This work highlights the potential for whole blood thrombin generation as a future tool in diagnostics and therapeutics of trauma-induced coagulopathy. Thank you for the opportunity to share our work.